What is diabetes and how does it affect us? This is a question many often find themselves asking. Let's delve a bit deeper into it. Diabetes is a medical condition that affects individuals irrespective of their age or lifestyle. It's an ailment that occurs when the sugar levels in your blood, also known as glucose, are overly high. Such a situation can occur due to two primary causes. Either your doesn't produce sufficient insulin, or your body isn't responding to the insulin's effects as it should. Now, you might be wondering, what is this glucose and insulin we're talking about? Well, glucose is the main source of energy for your body. It primarily comes from the carbohydrates present in the food and drinks you consume. On the other hand, insulin is a hormone that helps this glucose reach the cells in your body, providing them with the necessary energy to function. Without a sufficient amount of insulin, or when your body cannot use insulin effectively, glucose starts to build up in your bloodstream instead of reaching the cells. This situation results in high blood sugar levels, a condition known as hyperglycemia. If unchecked for a prolonged period, hyperglycemia can result in various health issues. Some of these issues include heart disease, nerve damage, and problems related to eye health. Now, it is important to note that there are various types of diabetes, each with its unique causes and implications. The most common one is type 2 diabetes, which occurs when your body either doesn't produce enough insulin or your body's cells don't respond to it normally. Another type is prediabetes, which is a stage that precedes type 2 diabetes. In this, your blood glucose levels are slightly higher than the normal range, but not high enough for a diagnosis. Then we have type 1 diabetes, which is an autoimmune disease. In this type, your immune system turns against your own body and starts attacking and destroying the insulin-producing cells in your pancreas. Lastly, there is gestational diabetes, which develops exclusively during pregnancy and typically disappears once the baby is born. To conclude, diabetes is a complex condition with diverse types and implications, but knowledge of it can empower us to manage and even prevent it to an extent. Gestational diabetes develops during pregnancy and usually goes away after the baby is born. Diabetes is common, affecting approximately 37.3 million people in the United States alone, which is about 11% of the population. This health concern is not confined to America, it's a global issue. Across continents, roughly 537 million adults contend with this disease, confronting its everyday challenges. Research suggests that if current trends continue, we can anticipate these numbers to escalate, reaching a chilling 643 million by 2030 and a staggering 783 million by 2045. These figures underscore the gravity and sheer scale of the problem we face. It's a silent epidemic, slowly infiltrating our societies, impacting the lives of millions. Let's delve into the symptoms of diabetes, as it is crucial to spot the telltale signs early for better management. The manifestations can be varied and may include increased thirst, a phenomenon referred to as polydipsia. There's also frequent urination, medically known as polyuria, and fatigue, a relentless, pervasive sense of exhaustion. Visual symptoms can include blurred or hazy vision, a worrying sign that should prompt immediate attention. Unexplained weight loss can also indicate this condition, as can numbness or tingling in your hands or feet. This can be an unsettling symptom, often causing distress. Slow healing sores or cuts, frequent skin, and vaginal yeast infections also fall under this umbrella of indicators. While one cannot entirely prevent the autoimmune and genetic forms of diabetes, proactive steps can be taken to lower the risk of developing prediabetes, type 2 diabetes, and gestational diabetes. Healthy eating habits, such as adopting the Mediterranean diet, brimming with fresh vegetables, lean proteins, and healthy fats, can be beneficial. Moreover, physical activity is a potent tool in this fight. Aiming for at least 30 minutes a day, 5 days a week, can go a long way in maintaining optimal health. However, these are initial steps, and this information should serve as a launching pad. If you or someone you know exhibits these symptoms, it's imperative to consult a healthcare provider immediately. Remember, knowledge is power, and understanding diabetes is the first step towards managing it.